And we know the nutrition is the most important component of your daily life. It is very important chapter, module is building nutrition. With the nutrition, the first thing is that what's the most important part of the nutrition? You start the nutrition from the very beginning, from the node onset. And it is my habit in the lectures that after 2 minutes of lecture, I usually ask what I have got before. And this I can ask up anyway. Something I was telling you, in page number 8 in the left side, in page number 5, heart student from the left side. He or she should stand up and say what I have said just before. It means that I need attention of all my students to the discussion, and the last 5 minutes or 10 minutes or 5 minutes I discuss or interaction or discuss. So let us start. Now, from the neuro discussion, because this competency-based discussion, and this type of competency will be asked in the exam also. In the exam also, this type of questions are from these things. And we shall begin from the National Medical Counseling guidelines. Whatever the questions you got, I have questions you ask. But whose first step is only question answers, not the question answer session. So I will discuss in the chapter of this concept. If you know the concept is clear, you will answer. So let us go. We know the terminology, we know what is the terminology. You should know the pediatrics, you should know what is going on. You see the stories, you see, look at the side and see what is the infant last year, what 3 years, these 2 children, you see 6 years. The school is where all the apples and beginner analysis. Here the different terminology of pediatrics. So we will start nutrition from the very beginning, so nutrition of the newborn, then we will go step by step the nutrition of the adults. So this is a picture, and this will help to learn why this picture is so great. So this is things while starting a discussion or later with the breastfeeding. This is the topics of the lecture. Now you have got two competencies before that you start. So you need the breastfeeding and details of the breastfeeding. And what is important is that what is the recommendation of the breastfeeding? Last point, immediate initiation. Question will be asked, where the breastfeeding should be started just after birth? It is better to say that it should be started just after birth. Don't say it should be started with 1 hour, half hour, 2 hours. There is different books, different times. Some say half hour, some say 1 hour. It should be started just after birth. And all my students have to give another conception. Nowadays there is another conception is that breast body. It means just after cesarean section, put the baby. It is the habit of the surgeons, gynecologists, put the baby on the mother's upper abdomen, baby to go out. This is what breast body. This is a very good concept, and one of the students I was still doing PhD degree, Navi Mumbai College of Mumbai, I was judge session. Based recording the topics for PhD thesis. So, what is the important timing is that just after one to start, this is very important. Next important thing is the exclusive respect. This term should never throughout your life. As a doctor, you should never throughout your life. Exclusive respect means only respect, nothing else. Father is giving respect to the baby, and that is exclusive. No additional conditions. It's exclusive respect. Very important thing is that how long this should be continued. Remember, exclusive respect should be continued up to 6 months. And after that, in addition to the respect, you should give other course that is known as complementary course that should be continued up to 2 years. Beyond 2 years. So breastfeeding should be continued up to 2 years past. And if possible, beyond 2 years, how long there is no limit. When how long knowledge is about, breastfeeding should be continued. Exclusive breastfeeding up to 6 months. These are the questions which are asked in the exam, in the easy entrance, in the next easy entrance, and next one entrance. This type of question will be asked. Okay. So, now the complementary case after breastfeeding means after breastfeeding. What many other course should be started? It should be started after 6 months. 6 months is now, most important thing that in spite of this type of discussion for a long time, in spite of the discussion for a long time, the exclusive breastfeeding should be up to 6 months, and then you should start complementary feeding, and breastfeeding should be controlled at least 2 years, if possible beyond 2 years. In spite of that, now the National Family Health Service that reveals that in India, 45% in fact are not exclusively breastfeeding. So importance is that you being a student of this year, from the very beginning you should keep in your mind that exclusive breastfeeding is needed up to 6 months, and then you should start complementary feeding. Breastfeeding should be continued up to 2 years and beyond if possible, as per applicable by the mothers. This should be and state this message to your another when you will doctors and patients go there. This is the important thing. If there are some terminology of this terminology you know, it is exclusive breastfeeding. I have told you, pure breastfeeding means some mother is giving some boiled water or other things. That should not be, but they are giving it. Next is partial breastfeeding. That is, mother is giving breast milk in addition to the other artificial feeding. Partial breastfeeding. These are not desired, but this is the terminology you should know that. Because when you read from the different books, you see that this type of terminology is complementary feeding I have discussed. After that, we will give another course on 6 months onwards. Don't proceed. Page number 3, second row, page number 3, left side, second line. Stand up. You stand up. Don't proceed in advance. You come forward and sit. Come, take your bag. Please take your bag. Come forward and sit in the basket. These are the terms we are now used. These are the terms we are now used. Pronouns human name. Donors human milk. Now this concept is new. As the meat banking is now available in human milk banking concept is there. The other central meat banking is there. Suppose the mother is dead or mother is still living, milk is taken from the bank. Milk banking concept is there. So in that case, the mother will donate the milk to donors milk bank. Mother's own milk. Human milk is both mother and donor. Basically, milk is just coming out of space. And you see that sometimes working mothers, what they do, they respect the baby, keep some milk, we advise them that expressive breast milk when you go out of work. When you go out of work, you keep your breast milk, express milk, still working, and keep it there. If you keep that milk, it will stay in the normal temperature for 8 hours. There will be no problem. You should not boil the milk because it will destroy the components of the milk. You should keep it, it will be there for 8 hours. You can freeze it, and if you freeze it, it will be in the fridge for 24 hours. Okay? And in banking cases, all the best you can be kept in -2 degrees. These are not required for you, just to know these are the terminology I use for the when concept, they are common concept. Why so much importance, so much for the best. Why HOD said this lecture first? Because this is the most important part of the human life. If you give the best milk, it will be complete. If you give the milk, it's complete food. This is number one. Number two, you see that it contains the adequate amount of water, power, and vitamins. It is very rich in antibodies. And you see the cancer prospect ratio, right? Most important thing is that it sends to bonding between the baby and mother and the life company. Now remember the most important one. The first 30 minutes after birth is very, very vital. First 30 minutes after birth is very, very vital. Baby has very high alertness of the brain for the past 30 minutes. Okay? If the baby is able to look at the face of the mother, both mother and baby, they are looking each other in the face. Past 30 minutes. It gives really very important bond. This is very. Remember the second important point. The first milk which is produced from the human is colostrum, and colostrum contains antibodies and other substances which protect the baby's intestine like dogs. Intestinal epithelial formation and intestinal, say, bacteria, which are very important bacteria which are formed in the intestine. Healthy bacteria, that formation, and a whole body's immunity is developed in the first part of the first village mentioned of the human secreted colostrum. It is fluid containing much of the protein and antibody. It is very important things that with a very good advantage. These structures we have read in the anatomy. You know about these structures. Now, important thing is the positioning and attachment of the. This is very important. And what is positioning and what is attachment? Positioning means how to hold it. So, mother should put the baby with his form and elbow and hand. So, mother should put the baby. But remember, important thing is that the head, neck and body should be the same line. Should be the same line. You should not, the head should not be thinking like that. Okay? So head, neck and body should be the same line. This is important. Next important thing is that they should attach the limb. How do you attach? You see the attachment. So this is the positional points. These are more important points for the position. We do first thing is that they should hold in the same line. Second important thing is that baby should face the mother's breast. Definitely. Other house is easier to take the picture. Next important thing is that baby should be very close to the mother so that his abdomen touches the mother's abdomen. Baby's abdomen should touch the mother's abdomen. So these are the important questions. If the position is not correct, if the position is distant, then there will be disturbances in the brain. Now, what is attachment? These are the things you will ask in the MBBS process, in the next one examination, next two examinations. In all the examinations, these are the things you will ask. And remember, this is the class. May get some revision, but this is important case. We may not get a revision of the lecture class. When we discuss others in our areas. So this is very important. Please give attention to this lecture. Don't waste the time. Please give attention. Don't waste it. So, what's that? Baby's mouth should be wide open. This is important. Now, how to mount wide open? You know about the P-defense. What is the P-defense? If mother touches the nipple at the corner of the mouth, okay. Maybe you go to the last side. If mother is touching, then you not side. And maybe you look to the side space and look to the as soon as the baby opens the mouth, mother introduced the nipple and areola. As far as factor, nipple and areola. Don't think of the nipple and areola inside the baby's mouth. When mother introduced the nipple and areola inside the baby's mouth, baby will suck. They will suck the breast. How it will suck? It gives pressure on the areola. And this pressure is of the lactiferous sinuses, where the milk is accumulated. These are the lactiferous sinuses. These are the lactiferous sinuses. So if you give pressure, then there will be release of the milk. So baby is sucking. How the baby is sucking? Baby is giving pressure by its jaw on the lactiferous sinuses. This is done by the sucking reflexes. The first one is eating reflex, second one is sucking reflex. Then baby is swallowing the milk. So there are three reflexes in the babies which are helpful for breastfeeding. It's very asked medicine. What are those three reflexes? Looking reflex, sucking reflex, and swallowing reflex. Is it clear to you? So it's a helpful reflex. Even by the side of the discussion, I will tell some things. We may be asked at different times and different things. Now, this is about the physiology of lactation. I think you have already read in your physiology books in law. I am just outlining this. Now, the baby is sucking the breast milk, and you see the impulses are very what is when either say non-hypothalamus, the anterior and non-hypothalamus posterior, you see the anterior posterior is it's almost what are those? One is oxytocin. Oxytocin causes the contraction of the myoepithelial cells of the breast. What is the purpose? It compresses the alveoli and the milk is ejected from them. Is it clear to you? What is this anterior epithelium? It releases the prolactin inhibiting hormone. That is put on. Prolactin is released. Prolactin is released. And what is the function of the prolactin? It helps the synthesis. That is known from our physiology. Two important hormones, one is oxytocin, one is prolactin. Oxytocin causes production of myoepithelial cells and release of the milk. Prolactin helps in formation of the. And how this happens? We offer people sucking on the breast. Suppose if there is no, if the baby is not sucking, there is no chance of release of oxytocin and prolactin, so this lactation will be disturbed. Lactation will fail when the baby is not sucking the breast milk adequately. Suppose there is some problem with the nipple, it painful. Nipple is suffering from some, there is some ulcer in the nipple. That is called nipple sore. Then baby will not, mother is very much painful. So baby, mother will not try, will not give milk to the baby. It will be lactation. Suppose mother is in tension, anxiety, depression, fear, some illness. I will go to this time. Then breast milk will be decreased. Okay. So these are the factors, there are some factors where breast milk maybe just and that's what discussion is taken of that. Now sometimes you see the factors causing lactation failure. This is important. If the initiation is delayed, baby is contacting the mother is delayed, not allowed to contact. Now, why do you contact? What is the reason for that? Why the contact is delayed? Because it is the feelings, it is the purpose. The superstition. In the past competency of the NMC is that what are the superstitions? What are the cultural beliefs about the breast milk? We believe that grandmother, fathers, relatives, the mothers, even some healthcare provider, those who are taking care, they think that breast milk will form after giving some food to the mother. So after food. So in the past 3 days there is no breast milk form, and baby, that's why the baby is crying. Naturally, the baby is present in the environment of the mother. Intermittent sterile environment. That environment is sterile, that environment will be good, warm environment. And when the baby is out of the mother's womb, the outside, baby is exposed to the external environment. So environment says, baby is exposed to the altered temperature. Okay, baby is not getting the food supply from the mother unless umbilical cord is cut. And baby is facing some external anxiety outside. Baby is trying to go up to the mouth, so there is some effort going. So these are the extra spaces are going. These extra spaces causes baby to cry. And the fast cry is very important because the baby's chest a lot filled with water. And baby is to clear the water from the lungs. And that fast breath requires extra amount of pressure. It's a negative pressure. But breathing in, extra amount of negative pressure for breathing in, which can clear the ocean. And that is the faster. So when the baby cries very good after birth, the doctor's system and other staffs are very happy. They are very happy because baby is crying next, baby is not very clear, baby is producing sound. Okay. So this is very important. So baby will cry in the first 3 days because of the adjustment. And taking, considering that cry as the baby is not getting enough milk, this is a very bad idea. Are you sleeping? So what I have discussed just before? Stand up. What I have discussed just before? Please give the attention. I tell you give attention. If you do not like the class, you can go out. Okay? If you do not like, you do not like to know about the education part of this, pediatrics, you can go out. But you will have to pass the next part, where you have to get 50% marks. If you do not get, you will not pass the next one. Okay? Nobody can pass. Questions will set up on the center, LMC, you will have to attend the front of the computer, you will have to give the answer to this. So don't lose time, please give attention to the class. Give attention to the class. So next thing is that initiation time is very important. Next important, family support. Family also think that this mother is not producing enough milk. Milk is not there. Give other food. And they visualize the healthcare provider. And healthcare provider is doctors, and other staff. Even the healthcare provider believe that after 3 days, they need other, so they give some baby almost. Whenever you give the artificial feeding to the baby will in the pocket of confusion and baby rejects the mother. Whenever you give artificial feeding to the baby is in a state of confusion and baby rejects the mother. One important order that is. Now, sometimes if the mother is in employment, always doing some work, and if the adequate facility is not there, the place is not there, or the environment is not there for parents, or the belong to people, in that case, the lactation value will be true. But there was an example. I used to see on video one lady gave district visit, and a baby is under my control from the very beginning. and she used to be breastfeeding till exclusive breastfeeding for 6 months. Managing is all good at another things, speaking some things. Very important managing. So if you like to it, you can do it. So this is very important. So some problems related to breast immediate. And so pre-actives means feeding other things before breastfeeding. This is called pre-active. So that we has called failure of that. Now there are some social stigma. They are the different stigma of the way some say or said, which are usually say done by other things. Very good social stigma is that যদি ইকু কি পেশেন্ট का डेली टू वे इकु की पेशेंट का डेली there is some students इकु की breast milk is apt or not seeing the breast milk the needs are same these are the different social stigma this stigma you know this mother the breast milk cannot be seen baby is sucking machine that's so what the other people do? They will think the mothers have not enough milk, my baby is not getting enough milk, or if the baby is getting milk, then the mothers has something which causes increases milk and that is also bad for the baby. Isn't that social stigma? Or sometimes stigma is that these mothers may be suffering from some disease which is spreading to my baby. Or mother is giving the breast milk to the baby and she is not doing any work for my family. She is not cooking, she is not distributing food. So we are doing these things. These are the different social stigma which will prevent the mothers from breastfeeding. Some mothers will have boys in combination with girls. So as this is girl, so don't be breastfeeding. And since boy is there, then breastfeeding is going on. The reverse is true in some cases. So these are the different social stigma which are going on regarding breastfeeding. I have discussed this, the benefits of the breastfeeding. Very important benefits of the breastfeeding is that next important thing is that breastfeeding contains the inclusive antibodies other chemicals like lactoferrin very important lactoferrin it contains the basic lipase very important component basic lipase which help the digestion of the lipid. So you see, in addition to 88% of water, the remaining 12% of the breast milk contains the nutrients which are essential for the baby, and that nutrients is sufficient for the first 6 months of the baby. And baby will get average 30 grams per day, 30 grams per day weight in the first 3 months, and then after 20 grams per day weight for the next 3 months with the exercise. So, I am not discussing these things you know about MBBS. There are the different growth factors which are present in the breast milk. Epidermal growth factors, intestinal nutrition growth factors. What mother will get from the baby? In addition to the own satisfaction, in addition to psychological satisfaction, what is the gain of the mother? What is the mother's gain? What is the mother's gain in breastfeeding? Number one, mother's satisfaction is most important. So mother is satisfied. Permanent contribution to the mother and the baby is very important. incidence of the breast cancer and uterine cancer is increasing. What is the baby's game in addition to the pain? Baby's game is that baby is getting how baby is getting in addition to the nutrition. Baby is getting growth in very matter. On the past 2 years of that, you can extend it up to the past 3 years of that. Some people extend it up to 5 years of that. But we usually say past 1,000 days, including in the days in the mother's womb. So it's the past 2 years of life. It's very important for the baby's brain growth. And remember, in spite of nature, mother's expectation is a mother's incidence of breast carcinoma after carcinoma is very, very low. Mother plays the best role. Sometimes there is a belief that mother is going to breast mother, that can be true. Some problems with us in mother's breast is sad. That is totally wrong. Mother's hormonal is a key concept of the age. Mother's hormonal key concept of the age is body is toned down after breastfeeding because of the release of the hormones exposed to the mother. And baby's benefit is the baby's growth in addition to the mental and physical growth. In spite of the all powerful birth, there are about say 43% of all people in India, they are not achieving their full growth potential. We are not achieving our full growth potential, even in very actual communities. That is the importance of this concept in nutrition. So, past 2 to 3 years of life very important, and then giving nutrition very important part, very important component to that. And that baby should be responsive one. Baby should not be responsive like artificial or others. So breastfeeding is important, responsive feeding on demand of the baby. Okay? But then the types of say breastfeeding we are discussing colostrum now. So first thing we portray is colostrum, other conditional then natural baby. The important thing is that the preterm opposite baby is that preterm baby requires high amount of protein. High amount of potassium by the high amount of vitamin factor in intestinal growth, high amount of the other factors, and some chemicals which prevent the growth of the harmful bacteria like bacterial. So that is also present in enough amount in mother's breast to deliver. So vitamin also is very Now there is another process protein confinement. So you do get the baby breastfeeding. Now we usually advise the give breastfeeding to the one breast fast, complete feeding for that breast. You can ask me how long the feeding should be continued. As long as the baby is there. There is no time limit. It is not 10 minutes, 15 minutes, or 20 minutes. As long as the baby is there, the feeding should be continued. Is it clear? So it is depending on the baby. Baby should be satisfactory. So how baby is that every time baby is there, baby after satisfaction. The next time when you treat the baby, you give to the opposite person. What is the benefit of that? The milk contains protein and high milk. Protein contains more protein, less fat, and high milk contains more fat, less fat. Fat is destroyed for satisfaction, for satiety center. So high milk is equal. Suppose a mother is feeding at the same time left side and right side together. Baby will not be satisfied. They will cry. So this is very easy for government and IMBBS. So these are the okay. So who should not say income of the cows will come. As it is in the course, that's why I am giving days. Telling days. Human for all the purposes, human is superior. Inflation is what we do better. People about the chapter and holy absorb it is body. Very very important. Also, concept to one and which is important and how significant quality. They are not someone who goes very high. So we should not be recommend maybe you can manage the quality. This is just a comparison same. This is important. This is the mother is suffering from some say. You are also in the life of one side yes. In case of you are the deepest. In case of HIV, in our scenario, you should take permission from the family if the mother is capable of purchasing. She can give advice. Some advice, though some has a mass of this way. So if the family is capable of purchasing in HIV case, house, in majority of the cases in India, how does work? They are not capable of purchasing. So, doing the best. If there is others in aspects, coming from the ignore. That usually what is happening is the male in the place person in aesthetics also this what place and basically abscess treatment is insisted in the rest of the abscess but best treatment is not vehicle is also just if the abscess is very large is the best opposite size if it is specialist is smaller then don't think about the downstream process of the baby. So these are the different problems of the the important problems in the retracted lipid. Lipid is retracted inside. In that case, what you should do is the correction. This is one tendency you can't learn. And the reverse equation is and pull it. Liquid will come. After 2 days, we retract and that will be normal. With that, that's what I said. Also, this year of technologies is in agriculture. That's what the beginning. That is this is so neat. If the baby is not get adequate, baby is within the liquid itself, there will be some stone. And this is very, very painful. Mother rejects breastfeeding to stone. So in that case, we should advise the mother to take breastfeeding in correct position and attachment, correct position and attachment. And for treatment, we give some time limit on the store. And last part of the breastfeeding system, that should be given in the solely. Don't give any environment or the magical. It's important. Yes, because in the pressure of this, there is a huge application of the milk to the breast. So what is important? Express the milk or give the baby adequate protein and express the milk, walk on breast and breast access and discussed express this when I discussed this from this is important concept of baby hospital. Within our books of state, very important bias. Every hospital should have some policy, meeting policy. They should train all inform all and their mothers. So all these parts there or this new HIV. This will be the hospital practice. Hospital easy. Everyone competence level and see how this is important as an ILS Act. This Act is not to in a very good previously was to teach out the baby but attach another access the baby food and give its food. Yeah, not do like this. Protect the father, protect something, and improve the you see, this is IMS Act also important. So time is already over. Just I will ask 3 questions from the 3 rows. You want to discuss. In the left side row, the last bench, second from the left. Last bench, second from the left.
Actually, last practical class, I did not come to how this two subjects to be carried in that class. That A. Anyway, that A actually I discussed little portions about these things. The point for any investigation, but most important, identification of anything. Identification of matter, identification of subject, identification of goal, identification of the object, documents of anything. That is very important here. Today, actually, what we are going to discuss, this thing is actually most important thing, actually identifications of individual. Because everybody actually which identification was any examinations, any way, everything is actually what actually I was trying to get my email and put some password. Put some password. So when the examination, immediately the examination how? And in document, another way, other place in document. As a discussion, everything is all past. Actually, in classes. But actually, the identification of the individual is important in any process, civil or criminal. Here, actually, I am from taking the participation class, only concerning the legal process. So, you see, identification, how important it is. Initiate anything, anywhere. Because actually, without treated like a hall. Just that's told you just from outside belong. Outside belong. Anyway, so actually this story is very, very generous. Regarding these things, it covers everything. Actually, I start with this story. Regarding this investigation, how the nursing case. That's about how the nursing case. So, paper is very young, not to that, you will think of it based on these two. Actually, one of the princes, that is second son, that was a state, the erstwhile Bengal, or his Pakistan, now in Bangladesh. The second son, while actually in the vigilante, there, this time, what happened is this? I think probably you don't know, but that is important to me. So, actually, when he died, he was taken to the Phillips ground for the grave. But because of these heavy thunderstorms, was not created. The fire was not actually the fire. Jordan. And they left the place, leaving the record in the air. Suddenly, after who was talking? Please. After 12 years, it was actually 1909. After 12 years, suddenly, one man, your trainer, things, appeared in the States and claimed 1/3 of the property. Declaring that I am that person, said Umar, Ramana, second son. But naturally, this problem started there. They think that he was dead, but actually he was not born. He was completely fixed. So naturally, he was in Chennai. And Chennai came from his own way. And our brothers were there. One third of the brothers. So they said, no, we cannot get one. He was dead. He was dead 12 years back. How did he come back? Is he posted? You don't know. Nothing is doing with this. Actually, what he did, when he was there, he was taught a very interesting thing. That is, this story covers so many things regarding the body and regarding identities. So naturally, the first thing is the proper identity. It is a key most. After 12 years, how we get mental alive? Actually, he has been the property. So, he was given arsenic. Arsenic again is a poison. Probably you heard the names because you think that everybody is story that we take class and so arsenic can be a chronic poison. Then you use the cooling one. As arsenic chronic poison, active poison. Active poison that can kill. Active poisons with a heavy dose can kill. But chronic poisons that actually make a person to go and even keep the fatal dose, the person will not die. Becomes unconscious, incapacitated, unconscious, and in this case that happens. He was given the large dose of arsenic, but actually he had to almost for a long time. So naturally he got able to tolerate, and this is actually called arsenic effects. So he was not dead, and he became unconscious. And suddenly that star, the Naga is actually passing by, crossing the field. They got the body to high field. And they took him along with them. And he was suffering from complete amnesia. Amnesia is loss of memory. He forgot everything from the past. He regained it after 12 years. He actually come back. He is young, that actually just had and then he actually came back. And so, when he got back his memory, actually comes and plays the body. So I told you this material is simple. And it happens in arsenic form. also use point because we know the behavior case. So your person if you know the behavior case, the Lavendra was not actually one, actually by as the customs required is actually generally actually put in the river or the homes actually generally the product is right that's in the pipe. That's the happening. So somehow certain line for more than the 1,500 documents are text. And everything was considered. What are these things? Right from these things, convection, hoist. You know these things, everything as we discussed with you. Hoist, convections, trauma, trauma, tiger trauma, separating sores, ulcer, wound, and some molds. And that is very interesting thing. What they come to is came to go on the line and corresponding things a mold on the time. And actually move these things. So after measuring these things, 4% things, yes. Great and the picturization. And there was another thing, the other weaknesses, both sides are weaknesses, everything, and that particular mode had one thing star mark, but that not was not actually used here. So they established farming as I could say this in the best, and ultimately again people that are this time councils, they actually yes, he is the man who is very yes, and ultimately but by the time one died. So we could not be 2 years second the right. So this is a very interesting thing is how to establish immunity. So based on certain things, how it actually is there are certain things which can establish identifications, partially or just not conclusively. There are certain things absolute data of identification. So there identification is the establishment of the identity or the distinct individuality of the person, or in other words, we say personality of the individual. But it's an equal, but actually professor is personality and the individuality of the person is the personality of the individual. Both things are identification. Actually, in these things, everything has to be established to say, particularly in criminal cases. Because actually, how not criminal cases. So, everything criminal cases also is beyond a reasonable doubt. You must establish that. That's why so many things actually, whether the signatures can identify person, fingerprint can identify person, so many things are discussed. Probably I told you these things, we shall start our practical class, starting to fingerprint. Identification types. Two things. Already I said these things. I can say this actually because I can say it's complex and it's like it is actually that high. This is yes. Other persons can be. So these are the things actually economic or partial identity. That not actually does not establish the identity. And then complete absolute identification and partial identification. Complete identification will without it down and half the establishment of the personality of it. Check what position it belongs to the society. That is actually complete identification. And another is incomplete or partial. All complex, high, wise, complete as you know, wise. Suppose we ritual who are actually returning home at the gate of the night after the time. But we return home. That is home where they all of the night. Who come? Mom or Mama or things you see. We must come running and open the door. How they open? Identify you from your voice. So there are now processes how the person can identify the voice in all. that dead body, and if the person can make the right stand, footing, all of those things. So the proof that actually there is the dead body. But you got the dead body or the we will not see. We have not seen the things happen. But the things actually only after the body comes to know the things actually. Yes, that might happen. You have to prove that is the dead body or prove the criminal offense actually. So these things and why things by statute or by the all these things actually come to what is the criminal actually purpose identification process is very important. Make purpose of pursuing the identification of the dead body. So without the identification of the dead body, you cannot proceed. You cannot proceed. So like all these identifications, you get some spiritual more sometimes. Most of the time, they can't feel it. They say, what are spiritual? So we have to take these things to feel it. How do you have to describe it? Lost actually. Next class. Another story is there in St. Mark case. Here is the St. Mark case. This is a very interesting case. That is also identification. One person is not distinctly, and one person is actually missing. And next time, suppose to be one big smartwatch captured, but that is not key. And that smartwatch actually relates to the accumulation of the accumulation to the person. Suddenly, you go, that start immediately arm, quantitative outlet arm, card. So that's the process of investigation. Is the card arm with the baby. That start actually is the secondary part. But in that case, because how that arm was senior after days with the sound who's and there was one attachment probably with the kind of these things have to be treated who made it safe. So now the implication now that this is not possible. Ultimately it was announced throughout Australia. And it was identified the things by 2 years that and because it was permanent. It cannot be somehow it cannot be the permanent. That is very important. And ultimately it was found one person was actually charged of the body. What happened? How the actually the two persons in this purpose actually they were traveling by in car and stayed in the also stayed in the motel. Here because of these things by operations, one person stayed another person and he tried to dispose of things into the sea by putting the body in the box. But once he put the whole body in the box, the whole body is that cannot accommodate the whole body. Similar down, he is tired of the outside the box. They have to the boat, he got to the sea, and make the box in the sea. The shark gets the so this is the story. This is the story of how the shark gets the arm. But thing is this, after investigation, it was revealed that it was a dead arm. Not in the living time. So that is an interesting story. These are very famous in the process of the investigations and also to the process of the investigation. How if the finger, even a hole, even things can actually reach to the spot. How the crime was committed and what type of crime was committed. So this is a very interesting case. So who saw data about it? Too many. Data of identification of people, you will be now. Hey, too many. Now, this is a race. Race is scar is the cause of law, and all doctors have to perform these things by law. You cannot escape. You cannot escape. No doctor can escape from the medical examination. So this is the things. First, race, religion, sex, age, general development of stature, and the location stature means general hyperplanes of the body. Nature, complexion, coagulative house, all these were considered during the identification of the house, which is that actually you are the second son of the house state. So, example studies budget modes, birthmarks, very important, scar, very important. You see, the right identification point, the scar is here, bone is here, like this thing. All are permanent, either some things beside some magical and some awkward. In scar is awkward, and woman is awkward but permanent. You cannot change it, you cannot destroy it, and it will be lost. One scar can be destroyed or removed from the production of another scar. Otherwise, scar cannot be removed. It is the thing. And love formation scar, tattoo marks, wounds, occupation marks, occupation marks, and programs, very interesting story over there, and how they cigarette holder, the risk to the murder. So there is the occupation that happen. There are so many things. How is cigarette holders that risk? How between the adult and risk to the murder? So there is so many stories, very interesting, important. So all these things actually. So data, I'm not going to get that, but there's no things. Now you know the thing you are thinking that you are doing it. You must know this thing. Very important to be used everywhere. As it is absolute data. Absolute data identification. What creative fingerprint, store, DNA code, no fingerprint is absolute. So that things DNA also is just absolute like fingerprint. That's why the DNA profiling is now actually termed as DNA fingerprint. DNA has got no figure. DNA profiling, picture, structure. What things it is identification is absolute like fingerprint. Naturally, a number of DNA fingerprint because actually it says DNA profiling. Fingerprints are footprints. Fingerprints is absolute. That is how genetic fingerprint. Hey, doctor, what I am discussing, you never have in any meeting anyway. But you have to perform in practical life. You have to perform in practical life. It's not an examination class and other things. Because it is medical legal. Medical legal. You cannot escape from the legal responsibility. You cannot escape. In all your practice. Personal effects from most of the cases, you must get them. Somebody put as a program accident, then what happened is that caseous, which actually 200 bodies or actually still actually no, actually about 60 bodies escaped for 1.5 years because actually we were not identified. That is very important to settle this the body has to be identified. Compensation with anybody can come and claim that I will too much compensation. And sometimes for one body claimed by 3 or 2%. Everybody is saying this thing, they will use my what they have. So very important. So it's going to be activity. And all these things. And some data, I told you this, say mark, my now, handwriting, signature, and another is the particularly gait, attitude, they actually the now after these things, gaits, all these things, particularly identification. You can be identified just from the gaits. What gait is this? Some data available on the living parts of data by identification. Why is the person handwriting? The person is covered. Handwriting or fingerprints, their signatures. So naturally, these are things. You see, living person's handwriting, speech and voice, great speech or bad speech. Because again, medicine is knowledge is required, but common sense. You must, without common sense, you cannot actually treat a patient, particularly clinical side. Once you handle a patient, you need a lot of knowledge. So common sense is necessary. And common living and day, all the other data, you have to regularly perform those things to give superior to the code of law. Yes, see the law. Because in the eye of the law, all evidence doctors are expound. So you have to be very familiar and very accurate to investigate these things. Or you see practical, contribution, practical, and so for passing to the passing examination. So I am not going to say about the passing examination and getting good marks. But thing is this, you must avoid these things to save yourself. Save yourself to continue in your profession, medical level response to it. Because you cannot afford to deceive that law. So, identification, eight items of substances, A like, right? Like whatever. You stop checking that. What is the ABLI of the height? What is the ABLI of the height? What is the ABLI of the age? What is the ABLI? All these things, we need to know these things in medical is very important. For other things, we have other subjects. So, in medicine, in any subject, diagnosing, surgery, wherever we go, actually these things are here. We use that course. Because now these days, whenever I go to that course, actually, many times, I see this in one subject or one person, he is actually this very clear. So, surgeon, medicine, everybody is to treat the patient in the hospital. That means, whatever you do, whatever you say, whatever these things, any cases, anything of a doctor is very critical. That's what it is. But we have to investigate these both things. Come on, after cancer, this is important. Breaking the bad news is very important that in art. And now all the medical students must learn this how to do it. Before consent, you have to take to the office of the guys. All surgeons must take a consent. Without consent of the patients, you cannot proceed. You cannot give. You cannot even give the injection. You cannot give it to the office of the army. Say what is the goal there? He would actually one thing is very important. That's what I say. It has only to mrityu to the that means giving that is the dangerous and cannot be. That is a intravenous complication and doctors are bound by it. Now, doctor, anything you are doing with the patient, it is human life, say patient motive. The patient motive part. Then doctors may be responsible for causing the death of the patient. Subsequently, you have to be very careful what you say, what you write, what you things, everything. And prescription is the most prescription. Doctor prescription more willingly goes to the court as a medical company. Doctor को ये लिखे उन्हीं यही ऑप्शन लिखे थे ना डॉक्टर पेशेंट खराब हो गए उन्हीं यही इंजेक्शन में राइट पेपर से खाना उन्हीं इंजेक्शन का कोई नहीं है just very example style that very common problem of the hospital the problem of the hospital the board that is a very easy doctors उन्हीं यही बोलेছেন इंजेक्शन का कोई नहीं the bone injection. Actually, it's not that. What's the bone? So, this is a very common problem. Very common problem. So, I have to be very clear. So, next, the identification very important. Without identification, nothing can do. Nothing can do. Second question is, that is very important. Just date because it is marriage. The person was arrested. A person was arrested with a fraud in the ovaries, too many ovaries. And when there are 9 kilometers to the case, police is the all even said these things, 7 kilometers said, and And he had that, he had put something in the visual card, some letters and handwriting or instrument. The person who was identified 17 of them, they had a state. But again, after some time, after 2 years, another person was there. For the similar job, how the love and thought and like this. And you are identified another 19 person. He handed over like this thing, similar. Where the victor? I will be another thing like prove that you are be the faith. Who are related to the thought? So, just identification, it is very important. Identification is very important. So, marriage everywhere, age, identification, so many data, it is very important everywhere. So, you can take it, identification is important. In that, another category to identification, a child who is it is a individual responsibility of the police officer to do. So, pay distance for cases of the body, not that to do. If the normal problem, the police will take it to the wife, the mom, the something. But severe to train must get severe murders. Not in chop him from the banda. In the baggage from there is a way to something in the law. So naturally the only head person what you receive. So naturally this thing is. So I told you this person, this thing, just this is the problem, suffering from problem, this type of thing, and like all of these things and that time they will work and ultimately other people. Sometimes some hard, so naturally chopped about. Very, very difficult to identify. You get the same disheartening. On the one hand, one arm, so naturally, okay. Complexion, height, breadth, all these things, but still, those are the better identification. The data technology, some people basic computer base, basically the basic data basic pairs. A star race, a star is very important star. And the arm is sitting on it. I think the race is also 1.5, really 45 all I do. So, particular one who is came from the other country, and then we see what anyways, model or something like this. And that all, we escalate evaluation from some kind. So, naturally, first thing, learn to identify or really applicant that place can be identified. From the appearance, so other things, even from the skeleton. So, trace is one data which actually is global development. That global picture is first actually it's country in ground. Naturally, you know these things, they don't belong to that country. Quite specific, they belong to the country. And Mongoloids, all Indians, Mongoloids, in particular. So now the personal question, who is missing? First thing, everyone knows who is missing. But actually, that person is what we thought. Who is actually that person? We know who are the in a practical question. So how do we can do race from skeleton? Absolutely. No action. But only part of the body. In extent, no कुछ बटा हुआ है. यदि ये माथा, उनके हाथ, उनके पास तो कुछ नहीं. But in the mistake, that person is. So in this highly mutilated body, blood is established. Not only this body, but that identification, highly mutilated and murder. But chopped off. So here actually the body was scattered all over the left. The scattered body is some portion in the river, some portion in the and some portion in the right. And in the way actually how you say the movement of the hand, and from there actually start. So these things happen, frequently happen. There are a lot of mechanisms that can happen. I know practical process শিখতে হবে। We will discuss when the wavelength is used as the one discuss all the things, ratio, how to determine waves, start with the motion form, forces were to determine rates, and other forces and are to determine later. But these are called indexes. So on this process, with override, caseous, all these things are mostly from the population is mostly mixed race. So it's very difficult, but still these things it can be done, and there are some indexes again. You learn anatomy, but you are not forensic. Forensic anatomy, that people, eye socket, major and the things, palates, upper palates, all these things can determine so many things, and there is peculiarity, not only history, but also range. That actually, that you learn, that you call. All these things, actually, there are differences. But one thing always in the biology, actually, my lectures, actually, I used to give lectures to the judges. So, here I also said these things. In biology, stability indexes. So the absolute truth, if I get a body, that means this medicine works, they work up to the protection. And same thing, actually, because these things, there are so many biological differences. So naturally, that same medicine is same dose, you work with the same medicine. So really, the actually must be because in biology, stability exists. So, and everything what we pay will be continuous to range. That means, I mean, commonly Corona, who was actually 25 years, we said this thing, 25 to 30 years, like this. Because in 18 years, in this thing, the most important age is 18 years, we cannot say this thing, 17 to 19 years. 18 years, there is no data, the main thing is what actually the raw one, whether actually the man and woman in 18 years, evidence is 80 years. For a child under 17, why do we say under 17? That is the problem. Because actually, we smart certificate and other things. Just before you actually practical class actually for the latest age difference. It is very important age difference. What is the age? But the way what certificate is, they want what certificate comes. What certificate goes, what certificate pay. So that is the same way of the biological age difference. Match that. This is must. They send the both of the students, but particularly the group of the courses, software and the কিন্তু যতক্ষণ না এখানে ফরেন্সিক এক্সপেরিমেন্টেশন হচ্ছে ততক্ষণ এগুলো নট অ্যালাউড বিকজ সেখানে যদি একটা যদি আন্ডার 17 সেখানে একটা যদি ম্যাসিভ নিয়ে আসা হতো ওয়াই আন্ডার 17 এই একটা কথা বলেছিলাম সব ডাটা আছে সব কিছু আছে গবেষণা আছে কিন্তু 18 ইয়ার্স পরে আই ফরগট দিস যাকে এটা বোধহয় ওটা হবে না আমি বড় রিলিজিয়ন হওয়া যায় থেকে লালনের গান আছে না রিলিজিয়ন বলা যায় রিলিজিয়ন বলা যায় নট বাট এভরিথিং ইয়েস আমার যে একটা জায়গায় গল্প আছে তো সেখানে ম্যাক্সিমাম জায়গায় সব কিছু আছে মেল রিলিজিয়ন বলার জন্য মেলের মধ্যে কিছু মানুষ অকুপেশনের জন্য একটা মানুষ তাই না এই অকুপেশন চাই তার থেকে বোঝা যায় এটা দেখে বোঝা যায় major problem in college. I think so naturally, but still this thing. It is major college or the acid to the oxygen depends on the customer. But that customer is particular customer that relates in permanent marks in the particular. See, namaz pode do correct particular correct namaz pode do mark and Hindu bears will say she will Baba will behind Miraj Baba will behind something. How you know this from particular बोले जाए the particular color is different. In China, growth means that used by Bengal China city and as in media city, but the popular running, that is not Bengal there. So like it is not only this religion, also you can but so many persons died here, unknown, is come. And our responsibility to the biological cannot teach them. Cannot teach them that is very important. I again take it from we are listening to Gamma or sex. Hey, they could go out to sex and to reason. Is it a problem? Age, sex, nature, height, age, complexion, all the things. What is most important? What is most important? Sex, age, height, nature, and race. What is most important for your body? Right? Sex. Any other opinion? Height, age, weight, religion, race. These are things. But what would we say? But there must be some money. Yes, in all investigation, sex is the most important. Because once you identify sex, you can eliminate 50% of the population from the infection. Very, very important. The boy or girl, you are all class here, almost all similar age. Maybe too many of the similar height. But these things, but 50% of the boys and girls population. So immediately the missing person was male. So why by question the question is actually the female. I mean, 50% is female, all the 50% of the population is immediately with the identification. But is it that difficult? Yes. Very, very difficult. Sex identification already in all of the correct from the skeleton. What if you do the arm and the class? Sex. Very big dark what? Very big food. But where did you get the dark? How much is packet? Most of them is too many years. They took out something, said of please, without something, where actually no. Not recently what I had in the question. So, Bacha, hardware, you have to use a packet implementation. And the court of Subaji gave for 6 years. He said that the doctor is actually not there and then that 6 years, court of So naturally, very, very is not that easy. So naturally, you must transfer it. So you have not to use that things. You need articulate. But we are doing it. Pelvic bone actually same thing. What you are doing is একটা bone থেকে কি করে সব কিছু বলে দিতে পারা যায় তার age তার sex তার race তার stature all these things how you can handle and then positive development something different so it's very important so you must have so sex is important কিন্তু একটা কথা sex কখন বলা যায় না Living on it, police take the parking the department and 806, Harvard Flight, 806, so these things actually সব বাবা মাই ওই বেশি কিছু বলে না এটা বলে না যে আপনার এই করে only that can break. The heat is not magnet. So it is also important. So that in that case, shake calculation. How many calculation shake? There are so many shakes. So actually not discuss with my speech. So shakes are different ways. There is shakes. Normal shakes. Random shakes. Random shakes is very easy. How what other shakes is not that easy. So I not take the time.
কিছু তো মনে থাকছে নাও লাস্ট ওয়ান necrosis হচ্ছে gangrenous necrosis and fibrinoid necrosis. Do you remember when I gave you the example of immunity and immune-mediated damage? The same thing when it happens inside the vessel. This is a blood vessel, okay? This is actually a blood vessel. The blood vessel has been cross section like this, and this is the area you are seeing. So those immune complexes get deposited inside the inner wall of the lumen of the artery or a vessel, and that is where necrotic changes occur. Why fibrinoid? Because it releases lots of fibrin material, or rather fibrin, which appears eosinophilic. Identification. Examiner will ask you why. Number one, how do you know it's a fibrinoid necrosis? Because sir, number one, it occurs inside the vessel lumen on the wall, inner aspect. If you remember, artery has three walls. External medial, inner wall also. এখানে ভেতরে lots of inflammatory cells দেখা যাচ্ছে, যেটা আমি বললাম হলমার্ক। নাম্বার 3, red color দেখা যাচ্ছে। Red color is basically fibrin material being deposited. These three are the hallmark of fibrinoid necrosis and occurs typically. This biting, this occurs typically in immune-mediated reactions. And you understand, you have to go check out. Should I repeat? Here, occurs fibrinoid necrosis occurs in the innermost aspect of the fibrinoid body. तीन चीज आपको दिखाई देगी। नंबर 1 that is a neutrophils, नंबर 2 bright pink color को दिखाई देगा, नंबर 3 inflammatory मैंने बोला, नंबर 3 is basically the location। ये आप देखेंगे कि ये बाहर नहीं हो रहा है, ये अंदर हो रहा है। So whenever you get three things, जैसे आपको तीन चीज दिखाई दे रहा है, वैसे आपको दिमाग में आ जाना चाहिए कि fibrinoid necrosis है, और कोई necrosis ऐसे नहीं होगा। अगर दूसरा भी कोई necrosis होता, मान लीजिए इधर में आपका fat necrosis होता, तो ये लोकेशन में नहीं होता, वो बाहर का लोकेशन में होता है, वो whitish deposit होता है। अगर आपका coagulative necrosis होता है, तो that is एक definite area, पूरा area कवर होता है, आर्टरी के अंदर में नहीं होगा। caseous necrosis जैसे tuberculosis में ऐसे नहीं होता। caseous necrosis के सेंटर में whitish और degenerative material रहता है, उसके अंदर bacilli रहता है और एक color of lymphocyte रहता है। So that is how you differentiate. समझ में आ गया आपको? बाकी आप उससे मेरे श्योर मना करते तो okay. Now in your exams, देखे हो तो इसका मतलब picture और specimens. 99% of pictures there. Specimens will be there. One more thing, in any necrosis, this is also a change in the necrosis. Now I'm moving to this slide. Reversible or ischemic injury. Now try to understand one thing. Any cell damage, suppose there is a hypoxia. एक cell में मैं oxygen कम ले रही हूँ, there is hypoxia. Now first of all, the damage will be reversible. After that, the damage will be irreversible, right? Now when there is irreversible damage, that is necrosis, you can see. Look at this thing. Look at this structure. Two more things are very important. One is the structures are not identical. The protective structure lost हो जाएगा, right? Second one is a bright pink color. जब necrosis होता है, cell को more eosinophilic pinkish color होता है। हाँ, जब রিভার্সিবল স্টেজে থাকবে এই যে অনলি ফর রিভার্সিবল স্টেজ তখন দেখ এতটা কিছু হবে না শুধু সারফেসে ব্রেকস আসবে these are the surface vacuolations can you understand যারা পেছনে বসে আছেন বুঝতে পারছি তারা ব্যাপার দেখাচ্ছে এই একটা সেল এই আরেকটা সেল এই আরেকটা সেল এই আরেকটা সেল এটা রিভার্সিবল ড্যামেজ এই সেলের সারফেসে একটা ভ্যাকুয়াল রয়েছে দেখতে পাচ্ছিস দেখ এখানে একটা ভ্যাকুয়াল রয়েছে দেখতে পাচ্ছিস সবাই দেখতে পাচ্ছিস ভ্যাকুয়ালগুলো কোথায় হচ্ছে আর এইটা হচ্ছে নেক্রোসিস হয়ে গেছে দেখ সেলগুলো ডট 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 ফিনিশ হয়ে গেছে আর সেলের কোনো স্ট্রাকচার বোঝা যাচ্ছে না आपको समझ में आया मैंने जो बोला जो इनिशियली रिवर्सिबल डैमेज में उनमें देखिए कि सरफेस में आपका ब्लेड्स यानी वैक्यूल्स आते हैं आपको दिख रहा है इधर में वैक्यूल से इधर में वैक्यूल से और जो परमानेंट और रिवर्सिबल डैमेज यानी नेक्रोसिस है उसमें आपको ब्राइटनिंग कलर दिखाई देगा ठीक है और स्ट्रक्चर उनका डिजाइन लेवल नहीं होगा मतलब स्ट्रक्चर सब देखे के लिए भी तो आइडेंटिफाई नहीं कर पाएंगे क्योंकि वो स्ट्रक्चर सब गॉन वो खराब हो गए तो वो स्लाइड्स को जस्ट कवर इट अच्छे
ইনফ্লামেটরি সেলগুলো আপনি বললেন নেক্সাস দেখা যাবে সেগুলো এই সাইটোপ্লাজমে মানে বুঝতে পারবেন ইনফ্লামেটরি সেলগুলো যেটা নেক্সাস দেখা যায় সেগুলো কি সাইটে বোঝা যায়
Now, this is, as I said, this is an area of infarct. Now, try to understand that when you see this area, you can see a population of inflammatory cells. Now, these are not the tubule cells. These cells, though not very clear in this picture, these are actually the accumulation of the inflammatory cells. These are the tubule cells. But even if the tubules are damaged, muscle cells are inflammatory. Now, one more thing. In all the organs, you would not get all the signs of necrosis. Suppose in liver, we depend more in case of inflammatory cells. Liver में हम लोग inflammatory cells ज़्यादा मिलते हैं. That is the hallmark of necrosis. Apoptotic process. Oh, sorry, necrotic process. जैसे coagulative necrosis जहाँ होता है उधर में ऐसे dissolution मतलब structure पूरा ही आपको नहीं दिखेगा जैसे like pink patch blotch कैसे दिखेगा that is more a hallmark of coagulative necrosis वो आपको जैसे kidney में दिखता है so you have to understand कि necrosis का हर कोई features in all features 100 over 100 सब organs में नहीं रहता फिर भी आप में कुछ और दिखेगा that is the reason we have various forms of necrosis clear करते हो इसको now the last thing that I just wanted to let you know, this part of necrosis or apoptosis, there is one more entity which is a mixture of necrosis and apoptosis. This is known as necrosis. Another part of the same topic in continuation. Adaptation to cell injury. Now, I'll just tell you one thing. Adaptation process. कैसे पढ़ना है okay just understand this much adaptation is basically suppose I am giving a chronic injury এবার ওখানে তো সেলটাকে চেঞ্জ করতে হবে সেলের অ্যাডাপটেশন হলো ফর্মেশনস আছে কারণ এখন নিউপ্লাসিয়ার আগে যেমন মেটাপ্লাস্টিক চেঞ্জেস আছে তারপরে হাইড্রোপিক চেঞ্জেস আছে ফ্যাট চেঞ্জেস আছে মাইলিন চেঞ্জেস আছে মাইলিন কি আছে হাইলাইন চেঞ্জেস আছে এগুলো অ্যাডাপটেশনস এর পার্ট এইটা আমরা মেটাপ্লাসিয়ার আগে করব কারণ বেসিক্যালি জিনিসটা সিকোয়েন্সিয়ালি যায় মানে সাপোজ আ সেল ইজ হ্যাভিং রিপিটেড ইনজুরি ইট উইল undergo some morphological changes so that it can adapt to the injury it may be changes like fatty change highlights or even let's say to some extent or it may be total metaplastic changes that has to be covered in a different topic but যদি আজকে করে তাহলে ভুলিয়ে ফেলবে আমার মনে হয় আজকে তো এখন পুরো নিতে পারবে জাস্ট ওটা আলাদা ওটা আমার নিউট্রিশন আছে ওটা metaplastic changes আর adaptation পাওয়া লাস্ট যে এখানে যেটা আছে সেলুলার ইনজুরির মধ্যে এই জায়গাটা তো যেটা বিক্রিয়া ওদের বাড়িতে গিয়ে কি করতে হবে ফর থিওরি একটা হচ্ছে প্রো অ্যাপোপ্টোটিক এন্ড অ্যান্টি অ্যাপোপ্টোটিক মেকানিজমস এটা না তোরা আগে খাতা পড়বে না তোরা পেন ইউজ করিস না বসে মোবাইল করিস না ওকে আচ্ছা কারণটা হচ্ছে এক্সামিনেশনে তো লিখতে হবে। এটা একটা করবো, ফার্স্ট লাইনটা করবো নাম্বার 2। Tumor suppressor genes are just first line is tumor suppressor genes. Now under square series in Robbins, whatever you do, একটা chapter, that is chapter 8, molecular basis of cancer, সেটা এটাও পড়তে হবে, সেটা অবশ্যই পড়বে। ওখানে তোমরা দেখবি, যেটা আমি বলছিলাম, apoptosis basically anti-apoptotic এর থাকে তো, আর তো pre-apoptotic, that balance is disrupted. এই diagramটা সেখানে করে দিতে হবে। Please take a look, just last thing. Now suppose the principal value. Now suppose there is mitochondrial damage. What is ROS, do you know? Similarly, suppose there is activity of calcium, that is increased mitochondrial property and activity of cell enzymes. When you go through this diagram, now if you remember, the way I have taught you, first of all the organelles will be damaged, intracellular calcium will be raised, the membrane will be damaged, and furthermore, last step protein misfolding leading to DNA damage. So what happens after this? Activation of two apoptotic proteins. Why I gave you this diagram? Cell চারটে মেকানিজম দিয়ে কাজ করে সেল এই চারটে মেকানিজম at least তোদের জানতে হবে, বেসিক কনসেপ্ট। একটা হচ্ছে মাইটোকন্ড্রিয়াল ড্যামেজ, একটা হচ্ছে এন্ট্রি অফ ক্যালসিয়াম, যেটা তো বারবার বলছি, ক্যালসিয়াম একটি মাইটোকন্ড্রিয়াল প্রপার্টি আছে, যখন ক্যালসিয়ামটা চেঞ্জ হবে সেলুলার এনজাইমগুলো চেঞ্জ হবে। এদিকে ওখানে দেখলাম, দেখে নিন ক্যালসিয়াম এন্ট্রি অফ ক্যালসিয়ামটা জিজ্ঞেস করবেন যে ক্যালসিয়াম আসলে ভালো করে বলবে। মেমব্রেন ড্যামেজ হলে কি হয়? সাইটোপ্লাজমিক মেমব্রেনস। আর নাম্বার 4 হচ্ছে প্রোটিন মিসফোল্ডিং, মানে কোয়াপোপ্রোটিন আর অ্যান্টিপোপ্রোটিন প্রোটিনের ব্যালেন্সটা নষ্ট হয়ে যাচ্ছে। এই চারটে মেকানিজম কিন্তু তোদের বেসিক অ্যাটলিস্ট থিওরিতে জিজ্ঞেস করবো, মানে একবার তোমরা পড়ে যাবে, কারণ হয়তো ক্রস করবে। বেসিক কনসেপ্ট কোথায় কোথায় হচ্ছে, আমি যখন খুব এমআই কনসেপ্ট বললাম, সারফেস প্লাজমা মেমব্রেন, সাইটোপ্লাজম নিউক্লিয়াস, ওটাকে ইন ডেপথ ওদের বইতে একটা দেওয়া আছে। জাস্ট গো থ্রু দিস ওয়ান্স বিফোর ইউ অ্যাপ্লাই ফর ইউর এক্সাম। কিন্তু সকলতে হ্যাঁ করছিস, তুই আলটিমেটলি পারবি তো না। আচ্ছা মোটামুটি এই অবধি ক্লিয়ার? তোরা বুঝেছিস না? লাস্ট পার্ট হচ্ছে সাপোজ প্রোটিন মিসফোল্ডিং, শুনে প্রোটিন মিসফোল্ডিং এর কি হচ্ছে? প্রোটিন মিসফোল্ডিং এর পর এটা ডিএনএ ড্যামেজ যখন হচ্ছে, দুটো সিকোয়েন্স অফ জিনস আছে, একটা হচ্ছে অ্যান্টি-অ্যাপোপ্টোটিক জিনস, একটা হচ্ছে প্রো-অ্যাপোপ্টোটিক। যখন ডিএনএ ড্যামেজ হয় তখন এটা যে ব্যালেন্স আছে, সাপোজ অনেক ক্ষেত্রে প্রো-অ্যাপোপ্টোটিক জিনসটা বেড়ে যাচ্ছে, অ্যান্টি-অ্যাপোপ্টোটিকটা কমে যাচ্ছে, তাহলে কিছু সেলুলার র্যাপিড অ্যাপোপ্টোসিস হচ্ছে। সাপোজ উল্টো হচ্ছে, অ্যান্টি-অ্যাপোপ্টোটিক জিনসটা বেড়ে গেল, প্রো-অ্যাপোপ্টোটিকটা কমে গেল, তাহলে কিছু সেলুলার অ্যাপোপ্টোসিস আর হচ্ছে না, proliferation হয়ে যাচ্ছে, নিওপ্লাস্টিয়া হয়ে যাচ্ছে। So this is a basic balance যেটা মেইনটেইন করা হয়। This is not exactly similar to cell aging. যার জন্য আমরা বলছি না program cell death. This is a program that regulates it. It has to be in a balance. It is not that program that regulates the normal cell cycle and death. No, that is a different program. Both similar but different. This is rather the actual program. Am I clear with this? Sure. The rarest thing that may be given to you in the practical exam is an ultrastructure, electron microscopic images. Generally, এখন কিছু করতে হবে না, যদি করতেই হয় আরো কিছুদিন পর তোরা যে কোনো রবিনসন পেয়ে যাবে, দু একটা ইমেজ আছে আমি বলে দেবো, তো এক্সামিনেশন ফ্যাকাল্টি বলে দিতে পারবে, তাহলে ওইগুলোই দেয়, ওগুলো একটু দেখে যাবে যদি টাইম পাস। তোরা আল্ট্রাস্ট্রাকচার চেঞ্জেস তোরা দেখতে যাবে, এক অর দুই ইমেজ বিফোর ইয়োর ফাইনাল এক্সাম, বিকজ দে মাইট বি গিভিং ইউ সাম কোয়েশ্চেন্স অ্যান্ড ইন দ্য ফর্ম অফ images as spotters. Yeah. Any questions from today's class? Feel free to ask. Mainly coagulative necrosis মানে তার exact mechanismটা not very clearly known. আর একটা reason হচ্ছে brain blood supply এর orientation. Coagulative necrosis যেখানে হচ্ছে end artery supply দিয়ে। কিন্তু ব্রেনে হচ্ছে একটা সাপ্লাই সিস্টেম মেইনটেইন করে যার জন্য সার্কেল অফ রিলিজটা মনে আছে সার্কেল অফ রিলিজ যখন সাপ্লাইটা মেইনটেইন হয় ইন্ডিভিজুয়াল সেলের যে স্ট্রাকচার গুলো ওখানে একটা ওয়েট শেপ ইনফ্যাক্ট কোনোভাবে করতে পারে ওখানে সেলগুলো মানে যেহেতু আর্টারিজ গুলো খুব ফ্রাগেল অনেকটা স্প্রেড করে যায় ন্যাচারালি সেলের স্ট্রাকচারের জন্য আর্টারি সাপ্লাইয়ের জন্য সেলগুলো খুব ফরওয়ার্ড হয় লিকুইফ্যাক্টিভ এর মতো হয় সেমি সলিড রাদার দ্যান আ সলিড এরিয়া সলিড এরিয়া কখন হবে যখন একটা সেগমেন্টাল ব্লাড সাপ্লাই থাকছে সেগমেন্টের জন্য সেগমেন্ট ইভেন তোরা কিছুটা হলে তোরা লিভার করেছিস লিভার মনে আছে একটা সেগমেন্ট করে ওখানে একটা সেগমেন্ট এফেক্টেড হলে একটা সেগমেন্ট এফেক্টেড হচ্ছে বাকি সেগমেন্টগুলো তো মেইনটেইন হচ্ছে ওখানে কমপ্লেক্স করে ন্যাচারালি ওরা ইন্টিগ্রেটটা ধরে থাকে আমি কি বলছি শুনছিস শুনেছিস আমি তো কথা শুনে যখন একটা কোঅপারেটিভ নেক্রোসিস যখন ব্রেনে হচ্ছে কোঅপারেটিভ নেক্রোসিস কেন হয় সরি লিকুইফ্যাক্টিভ এই কারণে হচ্ছে বিকজ এক নম্বর ব্রেনের ব্লাড সাপ্লাইটা একটা সার্কেল অফ রিলিজ দিয়ে যাচ্ছে ওখানে গিয়ে এন্ড পয়েন্টে গিয়ে আর্টারিজ গুলো খুব ফ্রাগেল হচ্ছে এক্সাক্ট কস্টটা একটু আমি জানি না যতদূর আমার নলেজ আছে যে আর্টারিজ গুলো ফ্রাগেল হচ্ছে সেলস গুলো যেগুলো আছে ওগুলো তো কোনো সেগমেন্টাল ব্লাড সাপ্লাই দিয়ে যাচ্ছে না ইটস আ জেনারেলাইজড সাপ্লাই প্লাস কি হচ্ছে জেনারেলি ইফ ইউ গো টু দ্য ব্রেন প্যারেন্টাইম এখন আমার হেমারেজটা হচ্ছে একটা হেমারেজ হলে কোন জিনিসটা স্প্রেড করে যাচ্ছে ন্যাচারালি ওটাকে ইন্টিগ্রিটি ধরে রাখতে হচ্ছে নাম্বার 2 হচ্ছে সেল স্ট্রাকচার ব্রেনের সেলস গুলো এরকম নিউরনস গুলো টিপিক্যালি এরকম যে ওটা সলিড থাকতে পারে ওটা লিকুইফাইড হয়ে যাবে আর 3 নম্বর হচ্ছে আর্টেরিয়াল সাপ্লাই ব্রেনের কিন্তু আর্টারিয়াল সাপ্লাই মাল্টিপল দিয়ে হচ্ছে সিঙ্গেল পয়েন্ট কি কিন্তু সার্কুলার প্রসেস দিয়ে আবার ব্যাক করছে ব্রেনের স্পেক্সেস দিয়ে whereas তোরা যদি লিভার দেখিস বা কিডনি দেখিস এটা হচ্ছে সেগমেন্টাল ব্লাড সাপ্লাই এবার একটা সেগমেন্ট যদি এফেক্টেড হয় বাকি সেগমেন্টগুলো তো নরমাল ওটাকে তো কম্প্রেস করবে ন্যাচারালি অতটা লিকুইফ্যাক্টিভ হতে পারবে না কোঅপারেটিভ সলিড থাকবে so this is the most important point in a solid infarct and a coagulative but infarctive parts are like red infarct white infarct কিন্তু that's a coagulative which is relatively more solid than liquefactive necrosis. Clear about that? Any further questions? Will you explain? Last question, will you? Tora? You have to class to শেষ হলো স্যার ছাড়ছে না কেন কথা বলছে ওকে দেখা আমি সব ঠিক ওইটা পার্টি তো তখন তোর কেটে কেটে বলার কি আচ্ছা তোরা বাকিরা বলবো কি ক্লিয়ার তাহলে অ্যাটেন্ডেন্স করে ছেড়ে দিই লিভারে অনেক টাইম এটা এক্সটারনাল জিজ্ঞেস করতে পারে দিস ওয়ান কোশ্চেন তো তুমি বলছো যে ইনফ্ল্যামেটরি সেলস important true where is it important have you ever seen the presence of inflammatory cells then these cells are in liver histopathology or in liver biopsy when we see those hepatocytes presence of inflammatory cells in a particular region is indicative of necrosis this is very important baki jagah to hoy but most important in liver is very chena jay because dead cell to amra bujhe pabo suppose I'm looking at an organ microscope e dekhchi now he comes and says sir idhar mein to necrosis hua tha now how do I know whether the cells have been actually there is necrosis or not presence of inflammatory cells clear so one more us so am I clear up to this মনে থাকবে তো ইনফ্ল্যামেটরি সেলস ইন নেক্রোসিস এন্ড ফ্যাগোসাইটেড অ্যাপোপ্টোসিস এই অবধি মনে থাকবে পরীক্ষা বলতে পারবেন
তাহলে অ্যাপোপ্টোসিসের থেকে ইনফ্লামেশন হবে না
অ্যাপোপ্টোসিস জেনারেলি ইনফ্লামেশন হয় না ফ্যাগোসাইট আসে টুকরোগুলোকে খেয়ে নেয় so fragments when the fragments are there the phagocyte comes and eats those fragments that is apoptosis and in necrosis there are lots of inflammatory cells lots of inflammatory cells now this is important because this is how we identify necrosis If I am, suppose I am a pathologist, I have to write a report where there is necrosis. Now, your obvious question is, sir, if the cell are necrosed, how do you know? May or may not be present the necrosis by presence of inflammatory cells. Now starts your DOAP sessions. Basically, am I clear up to this? Before that, I need to cover one more types of necrosis. This is the last thing that we need to cover from theory aspect until this. Coagulative necrosis. Coagulative necrosis means where there is decreased oxygen, hypoxic injury হচ্ছে বা decreased blood supply হচ্ছে। আচ্ছা, সেখানে decreased blood supply হলে কি হবে? The cell could be necrosed but having a clear outline. সেটাকে a localized area of coagulative necrosis is known as infarct. Now this is a question examiner asks you in your MBBS level. যারা এমডি করবে তাদেরকেও জিজ্ঞেস করবে, যারা ডিএমডি করবে যারা জিজ্ঞেস করবে, যদি ডিএম করিস তখন জিজ্ঞেস করবে what is the difference between infarct and necrosis. Please note a localized area of coagulative necrosis is বাকিগুলো ভুলে যাবে, নোটটা করে রাখো। এই যে এরিয়াটা দেখতে পাচ্ছিস, দেখতে পাচ্ছিস এরিয়াটা, এই এরিয়াটা হচ্ছে একটা ছোট coagulative necrosis। পরীক্ষার হলে কি আসবে? পরীক্ষার হলে যেটা আসতে পারে একটা স্পেসিমেন দিতে পারে এরকম, যেটা তোদের না দেওয়া চান্সেস বেশি, একটা ছবি দেখাতে পারে, ছবি দেখে বলতে পারে এটা কি, তুমি বলো নাম্বার 1 তোরা বলবি ইটস এন এরিয়া অফ coagulative necrosis বা infarct। নাম্বার 2 কোশ্চেন যেটা জিজ্ঞেস করবে হোয়াট আর দ্য টাইপস অফ infarct, red infarct, white infarct, কোথায় হয় সেটা জিজ্ঞেস করবে, লিভারের লাংসের কিডনিতে এক্সেট্রা এবং coagulative এখন এই যে টাইপস অফ infarct হচ্ছে। আচ্ছা, why this wedge shape? The জিজ্ঞেস করবে কেন single suppose, now suppose consider this is a cell, right? This is an area. Now it has many blood supply. Now each and every blood supply, each and every artery supplies to a specific area. So suppose one artery is gone or one branch is gone, তাহলে শুধু ওই এরিয়াটা affected হবে, বাকি এরিয়াগুলো নরমালি মেইনটেইন হবে। অনেক জায়গাতে ডুয়াল ব্লাড সাপ্লাই আছে, সেখানে এটা চান্সেস হওয়াটা কম। মনে রাখবে। Now the question examiner also asks you, please note this, and if possible just write this, which are the organs where you do not find coagulative necrosis or infarcts?
The brain.
And কোথায় white infarct, কোথায় red infarct? Just follow this loop of always সেখানে blood supply এর ব্যাপারটা মনে রাখবে, single channel blood supply না dual channel blood supply, মানে একটা আপনি দিয়ে তো দুটো আপনি, that is very important, not venous venous to venous। अब जब हम इनफैक्ट डिटेल्स में जाते हैं थोड़ा पढ़ा है, जिससे हम बेसिक आउटलाइन का बोलते हैं सेशन। আমি একটু আগে বললাম না যে প্রত্যেকটা জিনিসের একটা গ্লস, একটা মাইক্রোস্কোপি, এটা হচ্ছে মাইক্রোস্কোপিক ভিউ। দেখ এটা হচ্ছে ওয়েট শেপ প্রিন্টিংটা মাইক্রোস্কোপিক ভিউ অফ দি ইনফ্যাক্ট নরমাল ভিউ। আচ্ছা, ফার্স্ট ইনিশিয়ালি তোরা এটা দেখে কি মনে হচ্ছে? ওগুলো পিঙ্ক আর ব্লু ডটস, তাই তো? তার থেকে বেশি কিছু মনে হচ্ছে? হচ্ছে না তো? ক্লিয়ার? এবার একটু মন দিয়ে দেখ, দেখতে পাচ্ছিস সবাই? আচ্ছা, এই জায়গাটা একবার এই জায়গাটা মন দিয়ে লক্ষ্য করতে, সারা টেক টু ক্লোজ এন্ড লুক এট দিস থিংস। হাউ আর দিস অ্যারেঞ্জড? These are arranged some of the এটা শিখে নে, কারণ তোর সাইডটা আর শিখতে পারবে কিরকম লাগছে এটা দেখতে, গোল 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 একটু মন দিয়ে দেখো, এগুলো কনসেন্ট্রেট গোল গোল লাগছে তো, হ্যাঁ শিওর তো? আচ্ছা, এবার আমি যদি বলি কিডনিতে যে টিবিউলস আছে, টিবিউলস মানে এরকম একটা টিউবের মতো টিবিউলস, রাইট? But এটা থেকে আমি suppose the tubule. Now suppose I take a part of this and have a cross section. Now this is how you see it in the microscope. How would it appear? Gold. So basically, have a look. These are actually part of those tubules. These are the cytoplasm of the cells and the blue of the nucleus. Can you make it out? Small tubules. Suppose this is a tubule. There are lots of tubules. Let's say Suppose there are so many tubules. Now we take a cross section of this tubules. When you learn grossing, we'll go to that. Suppose you cut it like this. And this is how it appears. This round tubules. This is exactly those things. What do you say? Clear up to this kidney tubules will become access. Now, do you remember anatomy structure chilo, glomerulus, Woman's capsule? What else? Sure. But that data also glomerulus. Eso. এটা হচ্ছে Woman's capsule. বুঝতে পারছিস? Sure. বুঝতে পারছিস তোরা? কার বুঝতে অসুবিধা হলে আমাকে বলতে পারিস। Clear? If you have any difficulty, you can say. Because I could myself understand this till last 2 months of pathology. Very few. I had to study a lot in the last 3 months. It was 1.5 months structure. So don't do the mistake that I committed. Learn history from the very beginning. Don't feel ashamed. Anyone having any difficulty, you can tell me. Sure. What is this glomerulus and this? No. The summary of the story is basically microscopic view of the ejaculatory normal period and necrotic cells in the infraction. Is it end infraction? See this L. This is the normal cells, and these are the infraction. Now, look at this infarctive cells. Can you make out anything?
Outliers actually.
That taken infarct is I. এইখানে যে আই করা আছে না, এই যে আই দেওয়া আছে তো কিছু চেনা যাচ্ছে না সেলগুলো কোনো ব্লু কোনো পিঙ্ক কিছু সামনে নেই আর it's already it's just some outlines. So this is infarct. Now as a pathologist external examination কি করতে পারে? তিনটে জিনিস করতে পারে। একটা স্লাইড দেখাতে পারে, দেখে বলতে পারে এটা ইনফ্যাক্ট এটা নরমাল অ্যাবনর্মাল করো। একটা গ্রস স্পেসিমেন দেখাতে পারে, গ্রস স্পেসিমেনের ছবি দেখাতে পারে। দেখার দ্বারা বলতে পারবে এটা ইনফ্যাক্ট এটা নরমাল। এই জায়গাটা ইনফ্যাক্ট রয়েছে, এই জায়গাটা ইনফ্যাক্ট রয়েছে, এই জায়গাটা নরমাল বলতে পারবি তো? মাইক্রোস্কোপে বলতে পারবি এটা নরমাল এটা ইনফ্যাক্টিভ রিজন। এই অবধি বাস, আর কিছু লাগবে না। Sure. Clear up to this. So this is basically a form of coagulative necrosis. After that, there is another form of necrosis known as liquefactive necrosis. Now, I will come to that just now. Do you know what is liquefactive necrosis? Do you need break for 5 minutes? Dumba chalga ke kore ni bish din chal rahe hain almost half dunia ke একটু পড়লে কষ্ট করে ঘুরে পড়িস না লেগে যাও ইন্ডিভিজুয়ালি মাথা শুরু করতে পারে হ্যাঁ আচ্ছা যতক্ষণ পড়াচ্ছি বুঝতে পারছিস তো এগুলো বলতে পারবি তো বেসিক্যালি अच्छा हम जस्ट सिंपल बोलते हैं नेक्स्ट होता है liquefactive necrosis liquefactive necrosis will be brain area it's basically what happens in liquefactive necrosis cells go into semi solid area it's not a solid area it's a bit semi solid that's why known as liquefactive necrosis typically brain area a region that is deviation again in your DOAP sessions what happens and in your final examination you will be given a specimen 20% chance, 80% chance of the specimen a picture. Picture they will know what is this. What is a liquefactive necrosis? Still we पूछ भी that ये जिनिस तो देखते हो क्या hemorrhage हुआ है ना या ये इसका सेंसर का consistency तो नाम बोलो but you can appreciate. Number 3 caseous necrosis. Again the most important thing in your entire MBBS career hypersensitivity and tuberculosis. Caseous necrosis, opposite tuberculosis. 101% sure, every alternate student will be asked this. What is caseous? Cheesy. Where it happens? Which condition? Infection? Last name. Good. बोलते बार भी. Caseous necrosis? हाँ बोलते हैं. बोलते बार भी तो sure. ताकि ऐसे है ना कुछ तो कहो. এত নার্ভাস এত ভয় বলে হবে না, feel free to speak. Examiners যত চুপ থাকবে they will keep to asking. Do not give wrong answers, but try to speak out the things. And at least আমার সামনে ভয় পেতে হবে, I'm not going to scold you, but try to utilize the time to the maximum. Caseous necrosis মনে থাকবে? Sure. Caseous necrosis এ তোরা যখন tuberculosis করবি তখন ওখানে আসবে bounce complex, bound focus কিভাবে হয়, একটা central area of necrosis থাকে, surrounding area column of lymphocytes থাকে, মাঝখানে tubercle bacilli থাকে, ZL stem করে দেখতে হবে, these things later on. But up to this you can understand, right? Sure. Fat necrosis. What is fat necrosis? I understand this. Suppose there is a acute pancreatitis in a patient. Okay? Pancreatic lipase leaks out from the pancreas. If it leaks out, it moves to the peritoneal cavity, seeps to the fascia of the perineal space. Surrounding cells যেগুলো আছে, the surrounding when you have to anatomy যখন পড়েছিস মনে আছে abdominal peritoneum উপরে এবং নিচে একটা ফ্যাটের লেয়ার থাকে, প্রত্যেকটা অর্গানসের সাইডে একটা ফ্যাট থাকে। তো এই pancreatic lipase ওকে ঢাকিয়ে বসে pancreatic আর এদিকে তাকাও, that it's normal because every now and then I see one of you drowsing. There's nothing abnormal in that. Even I used to do the same, but try not to do the same because I have to suffer a lot during my MBBS. Don't go through that suffering. Because so pancreatic lipase what happens? The fat cells গুলোকে dissolve করে দেয়. Now common sense. Suppose it's a pancreatic lipase. It acts on a fat cell. What will happen to the cell? ভেতরে triglyceride বেরিয়ে যাবে. The cell will be empty. কিছু থাকলো না সেলের মধ্যে। After that, triglyceride বেরিয়ে যাওয়ার পর এই ফ্যাটি অ্যাসিড গুলো ওখানে বডি ক্যালসিয়াম আছে তো ক্যালসিয়ামের সাথে রিঅ্যাক্ট করে white deposits in the fat like this. These are known as fatty deposits. Okay, but this is actually not a necrosis. Because fatty, rather than the fat cells the fat is being esterified further into triglycerides and fatty acids. Those fatty acids are reacting with calcium and getting deposited. Clear up to this? One other bit. Sure.